Hope for Women International, a multi-speciality clinic located on the AB Toba Road, Painesville, Liberia. A quiet haven away from the hustle and bustle from the city, but easily accessible with connecting roads to get to. The facility has an emergency department that is ready to tackle any problem or patient needs. Consisting of many rooms, a staff of well-trained nurses and doctors. "24-hour, around the clock. The department is capable and ready. A full automated laboratory that runs 24-hour, that provides quick and accurate results of almost all laboratory tests.
On the line of prices, our prices had to be competitive because without any funding or resources, it's very difficult to keep the level of healthcare service that you have to provide. So if you have to pay nurses competitive salaries and have drugs that are up to date, whether they are from Europe, America, India, and laboratory equipment that will give you good diagnostics, ultrasound machines, and some of the new updated facilities, then you have to have competitive prices. So for me, I don't really believe that our prices are astronomical because there are places that you can go in Monrovia and you will pay at least 4 times what we are charging. The healthcare system in Liberia, the word that we use around is a robust healthcare system. What we need is a lot of initiator. We need motivated people. We need people that are concerned. Policies are there to be followed. But if you don't have people that will follow the policies, then the healthcare system cannot go forward. So more initiators, more policies, but more people that are concerned and interested in improving our healthcare system. Hope for Women is also Hope for Liberia. What are some of the things that we want to see? I know a lot of people that can afford to leave the country will leave the country and go for medical checkup either to India, Ghana, America. But what about the people that cannot afford to leave? You know, mostly those who are less fortunate, those who are up in the southeastern part of the country that cannot even afford to have a small health center in their community. Those are the people that we are concerned about. So what we need to do is to take some of what we have and put it into a good health system or a good health center so that when we think about doing a mammogram, we can do the mammogram here and we can give you the result and we can give you advice on how to go. But you find yourself going to other countries and all of your funding goes with you there because it's not free that you are going to these places. You have to pay for room, you have to pay for board, you have to pay for airline tickets, you have to pay for the tests that you are going to run. So if you take all of that money and lump it and invest it into your country, then the need to go out will be less. So this is not a one person investment. This is all Liberian investment. Those who have can support those who have not. To the idea of people who are outside of the country and only say they want, why is the healthcare system not improving? We need you. We need you to come back to the countries to help us to build the kind of healthcare system that you are seeing outside of the country. So the more healthcare practitioners that are there that can make it their business to want to come back to this system, instead of bringing other people from Nigeria, Ghana, we can bring Liberians back to the country to help build our system. Most importantly, let's take for example the problem that we have with dialysis. My idea about dialysis is that we have a lot of Liberians in the diasporas that are on dialysis. For me, for us to get a good dialysis unit in Liberia, I think those people should get together and form a group and try to see how they can campaign for us to be able to get the best dialysis clinic in the country, because they are some of the people that are going to be taking advantage of this system. But everyone wants to sit and say, let them fix it. Who are the them that we are referring to, if it's not us?
Each patient is treated with personalized compassion and kindness, with friendly service, wonderful infrastructure, and national customer care staff. We believe in core value of excellence, respect, teamwork, integrity, and care that will motivate our staff to provide the best services to our patients. We have good water facility to meet the needs of our patients. Hope is competent enough to cater to the health needs with the kind of services they provides. Mr. Soso Jala, the engineer and brain, alongside Dr. Wilhelmina Jala, behind the Hope for Women's Clinic. He holds a BSc in mechanical engineering, worked at the LEC in the 80s, served as a technical project engineer at the World Bank for 5 years, and has a 10 years international experience in railway and elevator engineering.
Hope for Women, a vision of Dr. Wilhelmina Jala. So we are still under construction, but we are just about finished. So as you will see, we're just about to move in here in the next month or so. In the next couple of weeks, we should be opening.
The love to serve and save lives has led to the birth of this structure called the Jala's Medical Center.